Good morning, class. I would like to talk to you about Chapter 9, your joint chapter this morning. The body contains about 300 joints, and the only bone without a joint is the hyoid bone in the neck, which we learned about last week with the bones. Joints are also called articulations, and they're classified by their ability to move. So the first one there that is talked about is the fibrous joints, also called synarthroses. These have collagen fibers that kind of penetrate the adjacent bones right next to them, makes those bones very limited in movement. The suture lines in your skull are examples of fibrous joints. And then your cartilaginous joints are two bones that are joined by cartilage, your amphithoraces. These are slightly movable, and so the disc in your vertebrae are examples of a cartilaginous joint, and then the symphysis pubis is another example. The one I wanted to talk about the most, though, are the synovial joints. These are the ones that are the most numerous and also very movable in the body, and they all contain synovial fluid, which helps with lubrication with that movement. So if you look on page 140 in your book, there's a drawing of a synovial joint. You need to know the parts of this joint, knowing what the joint capsule is, the synovial membrane, which secretes that synovial fluid, that lubrication fluid, the joint cavity, articular cartilage, and the ligaments. The synovial fluid is really cool in the fact that it's a slippery, viscous fluid, looks kind of like an egg white. It nourishes the cartilage, it lubricates, and it also contains phagocytes for that phagocytosis, that cell eating, which removes debris. At the bottom of page 140 talks about some of the specific things that some of the joints have, the synovial joints have, such as the bursa, those little small sacs filled with synovial fluid. The elbow has a lot of bursae in those, in that joint. Page 141, the types of synovial joints you must know. There are a lot of different types of synovial joints. It talks about the ball and socket joint, which basically has a ball-shaped head that fits in a socket-like component. You think of the hip joint with the head of the femur into the acetabulum. The shoulder joint is also a ball and socket joint. The pivot joint, you have a projection from one bone that articulates with the ring of another. Think of the atlas and axis, where you have the dens of that second cervical vertebrae that goes up through that ring. So that's a pivot joint. The radial ulnar joint is also a pivot joint. The saddle joint it kind of looks like a saddle. You have a concave section and a convex section. And the only saddle joint basically that we have in the body is that of the thumb, and it allows your thumb a lot of movement to go to each finger. The thumb is a very unique joint, so that saddle joint really helps with that. The gliding joint, two bone surfaces that are flat that slide over each other. Think of a glider. And we see those in the tarsal bones of the ankle and the carpal bones of the wrists. The condyloid joint, you have an oval convex surface that fits down into a similarly shaped depression. The end of the radius and the carpal bones of the wrist are example. These condyloid joints allow for flexion and extension and side-to-side movement. And last but not least is the hinge joint. With that one, you want to think of a door, allowing back and forth movements such as flexion and extension. And your elbow, knee, fingers, and toes are examples of the hinge joint. On page 142 and 143, all of those movements of the synovial joints should be reviewed. There's some animation that goes with them, so you can look that up. But it reviews flexion, extension, abduction, adduction, circumduction, rotation, supination, pronation, inversion, eversion, protraction, and retraction. So make sure you know those. Page 144 then gets into some of the key synovial joints. The first one they talk about is the shoulder joint, also known as the humerus scapular joint and the glenohumeral joint. And if you, I skipped over it, but a couple pages back, the Body at Work talks about how the joints are named for the bones that articulate together. So it gives an example. The humerus scapular joint is the articulation of the humerus and the scapula. The temporomandibular joint, articulation between the mandible and the temporal bone, and so on. So that helps you know what joint you're talking about if you know the bones. So that's why you had to learn the bones last week. The neat thing about the shoulder is that it is very mobile. It is more mobile, though, than it is stable, so it makes it the most likely joint to be dislocated. And oftentimes it's dislocated if somebody has their arm out and there's a downward force coming down on that arm because there's not a lot of protection for the joint in that area. So children are also especially prone to having this joint dislocated. If they're down on the ground and a parent reaches down to pull them up or jerk them up off the ground, they can dislocate their shoulder. The joint has a lot of muscles, tendons, and ligaments, and multiple bursae around that joint. There's 5 principal ligaments, 4 bursae, and then the rotator cuff muscle, which you're going to learn a little bit later in the next chapter this morning. The elbow joint then is talked about at the bottom of 144, and you can take a look at that one. And then the knee joint on page 145 is really important. You need to know the parts of the knee. Specifically, you need to know the ligaments, the PCL and the ACL. I'm sure you've heard about those. A lot of athletes commonly injure that ACL, and the ACL keeps the knee from hyperextending, and the PCL helps limit the sideways movement of that knee. So knowing those two ligaments especially, you also have the fibular collateral ligament and the tibial collateral ligament that keeps the knee from rotating when the joint's extended. The other thing about the knee that you need to know about are the two menisci, or the meniscus in that knee. These absorb shock and cradle that knee. And oftentimes when you hear of people injuring their knee, it's either an ACL injury, but it could be a meniscus injury, a tearing of the meniscus. Either one of those, and if you look at the Body at Work on the bottom of page 145, both of those injuries oftentimes require surgery because the meniscus doesn't have, it's cartilage, so cartilage doesn't really have good blood supply, and ligaments don't really have good blood supply to them, so they don't heal very easily, and so surgery is often necessary, and we call that arthroscopic surgery. Life lesson at the bottom, 145, on arthritis. Arthritis talks about the inflammation of a joint. And it talks about the 2 different kinds of arthritis that you hear about most often. Osteoarthritis, which is the wear and tear arthritis that occurs over time, especially with people who have extensive weight, excess weight, and also aging leads to osteoarthritis. It says 85% of people older than age 70 have osteoarthritis. And then the rheumatoid arthritis is an autoimmune. The body basically sends antibodies and attacks the synovial membranes and leads to degeneration of the cartilage. And oftentimes, with rheumatoid arthritis, you will have joint deformity. And you've probably seen people who have had rheumatoid arthritis, maybe in the hands, and you've seen the fingers rotate off to the side. That is rheumatoid arthritis. There's over 100 different kinds of arthritis. But those are the 2 main ones that we think about. And then the next page is on the hip, talking about the hip, and you know how the femur, the head of the femur fits in the acetabulum. It's a little more stable than the shoulder because it's a deeper depression for that. The bottom of page 146 talks about joint replacement, arthroplasty. We think of hip replacement, knee replacement, shoulder replacement, but there's a bunch of different joints that people can have replaced nowadays. So take a look about that at that. You can have your finger replaced, your elbow replaced, and some other things, other joints that people don't necessarily think about. I would star The Body at Work on page 146 because it talks about why exercise is so good for people, especially if they have osteoarthritis. And people complain that their knees hurt and they don't want to move when they have osteoarthritis. And it's actually better for them if they do have some weight-bearing exercise. And it talks about why that happens. It says, joint compression when you exercises squeezes fluid and the waste products out of the cartilage. When that weight is removed, the cartilage sucks up the synovial fluid, kind of like a sponge, and that synovial fluid is what nourishes that cartilage, and it supplies oxygen. It also has phagocytes, like I said, that eat up that debris and things that are not necessary. So that's really important. And then the other part of that is doing the warm-up, because the warm-up before vigorous exercise helps the synovial fluid to be less viscid. And if it's less viscous, it's going to be more liquid and allow that cartilage to soak up a little bit better. Make sure you look at the life lesson on page 147 about the joint changes with aging. Read over that and know your key terms. Thank you.